President Trump is pushing back on speculation he suffered a major health issue last fall when he made a surprise visit to Walter Reed Medical Center. He's denying he had several mini strokes, a specific allegation nobody had actually made before he brought it up. Ben Tracy has more from the White House.
President Trump on Tuesday tried to squash any rumors about his health. In multiple tweets, he called speculation that he suffered a series of mini strokes fake news. He's referring to this. News cameras followed the presidential motorcade last November as it departed the White House for an unscheduled trip to the hospital. President Trump was there for more than 2 hours that day. He later tweeted this explanation: visited a great family of a young man under major surgery. Also began phase 1 of my yearly physical. But the president's routine medical checkup is typically announced ahead of time. And according to a new book from New York Times Washington correspondent Michael Schmidt, in the hours leading up to that hospital trip, Vice President Pence was allegedly asked to be on standby to take over the powers of the presidency temporarily, in case President Trump needed a procedure requiring anesthesia.
There was nothing out of the ordinary about that moment or that day. And
Vice President Pence addressed the claims last night.
I don't recall being told to be on standby. I was informed that the president had a doctor's appointment. I got to tell you, part of this job is you're always on standby as your vice president of the United States.
It's worth repeating that Schmidt's new book never mentions anything about mini strokes. The White House now claims that President Trump was actually responding to a tweet by former Clinton press secretary Joe Lockhart, who had questioned whether the president had a stroke. President Trump then directed his physician to put out a statement saying that the president's never been treated, or evaluated for a stroke. Anthony?
Ben, the CDC just announced a moratorium on evictions for most renters through the end of the year. I think some people might be surprised it came from the Centers for Disease Control. What can you tell us about that order?
Yeah, so the reason it came from the CDC is they say this is needed to slow the spread of coronavirus. They want to avoid having a bunch of people who get evicted ending up in homeless shelters or other crowded living situations. Now, to apply for this new rental moratorium, renters will have to be facing a substantial loss of income, the inability to pay their full rent, and show their best efforts to pay their partial rent. Now, those who apply also need to show that eviction would leave them homeless or forced to live closely with others. This does not relieve tenants of their ultimate obligation to pay their rent and only applies to individuals making less than $99,000 a year or twice that for joint filers. Now, this plan does replace a moratorium that was passed by Congress and expired back in July. It's estimated that millions could face eviction without more government help. Anthony?
Ben Tracy, thank you, Ben.